Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. We got a very special episode today because we have a special guest. But first off, with me as always is Kalee Dion Pear sneaking into my frame here. We're on the couch together. This is like new for us. So, But I want to introduce our special guest. I'm very, very excited to talk to her. She is a lawyer with 40 years experience. This is Kay Van Way. Thank you so much for being on the show.
You bet. Thanks for having me.
Oh, yeah. I'm really excited about this because I think that Kalee told you that I actually do some medical legal expert witness stuff. And we always talk about cases on the show that ultimately involve malpractice suits. So there's a lot of kind of crossover between what we talk about and what you talk about and what you do for a living.
Absolutely. And I've already concluded just in the past minute that you guys have a lot more fun on your podcast. You know, us lawyers, we tend to be a little serious and, you know, so y'all are an inspiration. We're going to need to have more fun.
Yeah, we try to. For this show, we try to make it informative entertainment. Like it's informational, but we try to also have some fun. So
when I first joined you, I was, because I work with Kay and friends with you and then work with you. And I thought to myself, God, every topic we talked about, I was like, we've got to have Kay. Like, Kay has got to come on here.
This is going to happen.
This is going to happen because that's pretty much all the stories we talk about. I'm like, I really would like to pick her brain on,
Yeah, everything. We talk about them on this show. We try not to sensationalize anything, but I think every case there's something to be learned from a patient perspective. I mean, obviously there's things the doctor probably could learn. But for us, we really like to go over these instances because there's always warning signs, and I think when patients are educated that it may, potentially prevent people from having these bad outcomes in the future. So, tell us about your legal practice. You've been in practice 40 years, is that right?
Well, I stopped counting after about 30. And of course, a woman my age is always self-conscious being around a plastic surgeon, because we think, oh my gosh, you're probably sitting there thinking, wow, whatever I could do with her.
Oh my, I would never do such a thing. Nope.
But yes, I have been a lawyer for quite a long time. I was in practice before we had a fax machine, before we had word processors, before we had legal books online. We actually had to go to the library and pull the book off the shelf and read the cases. I always wanted to be a medical malpractice lawyer. I don't know why exactly.
Really?
But from law school, I was like, that's the ultimate. So I had to work up to that. People don't come out of law school and then voila, you're a med mal lawyer. But this is all I've done for at least the last 30 years.
Has it always been in Texas, or were you in other states beforehand?
I started in Oklahoma, in my hometown. Started out as a hometown.
You're from Oklahoma?
Yeah.
Very nice.
Yep. From Lawton, Oklahoma.
Lawton, yeah.
And was fortunate to practice there in my early years, where my parents, when they were still living, they could come down and watch me cut my teeth trying cases at the Comanche County Courthouse. And, but I moved to Dallas decades ago and began honing my practice representing patients. So that's all I do.
Yeah, I think it's well needed. And I'm going to follow up because I have some questions for you about Texas in general as a state to practice malpractice law. Because as we'll talk about it does present some more challenges than other states. But so I think there's a common misconception with patients that any time that there's a complication that's malpractice. So how would you tell a patient or a potential client, like what is your definition of malpractice as it pertains to the law?
Well, it's a great question. And, I actually have to teach law students this. I have been an adjunct professor at SMU for many years. Very nice. And I tell them, a doctor can make a mistake. A doctor can arrive at an incorrect diagnosis, by way of example, or recommend a wrong treatment or something like that, and not be negligent.
Right.
And it's not like other areas of the law. We all know stop sign means stop. If you run the stop sign, you're negligent. But in medicine, it all boils down to the standard of care. Yep. And the standard of care essentially means what would a reasonable and prudent practitioner from the same school of medicine do or not do under the same or similar circumstances. Lay people don't know what that is.
Right.
Oftentimes, there's a dispute among medical experts about what that is because there's no book you can go to.
There's no
and
Bible
say,
of like standard care.
Right, page 73, it's right there, and everybody
right
agrees on what it is.
Yeah.
So what I find fascinating is that ultimately in any given situation, who gets to decide what the standard of care is a jury of 12 people picked from the community.
Yeah, jury of the peers.
Yep.
Yeah, absolutely. Do you have you had any cases that revolve around plastic surgery over the years? Is that something you see a lot? And I'm just asking this for my own interest because that's what I am involved in with malpractice suits as an expert.
Yes, I have, but they are very, very few and far between. Most lawyers like me would not take plastic surgery cases, especially if there was a dissatisfaction with the outcome.
Right. It's subjective.
Yes.
Yeah.
They're elective procedures, highly subjective. Failure to get the results that you wanted, that's a no-go.
Yeah.
What I have focused on are fraudulent cases, and we can talk about that, but where someone is being an entrepreneurial type doctor.
Practicing outside of scope.
Yes.
Yeah. In fact, a lot
That's a big pet peeve of yours.
Oh, it's huge because it's a huge problem in plastic surgery where the laws in states to me are too lax. Like what you can do in your own office under the law is basically what someone will sign a consent for. And so what ends up happening is you'll get non-plastic surgeons, like say a regular general surgeon or maybe like a dentist or oral surgeon or ENT doctor that's like, well, I'm just going to do cosmetic surgery. And they'll make a web page, they'll have a little office OR. And if they can, get someone to sign a consent that I'm going to do a tummy tuck on you, then it's not against the law. Now, is it a civil problem? I've found that it can be for sure.
Yes.
So, but that's like a whole nother ball of wax. But
I'd love to do a deep dive on that. I'd love to have you be a guest on my podcast because we could talk about that. We have a profit-driven healthcare system in the United States, which is some good, some bad.
Right.
And there are some entrepreneurial physicians who see opportunities to make money. And then there are loopholes in the law or lack of laws that allow them to go and be like, why not?
Yeah.
Why wouldn't I start doing whatever? And the problem is that consumers don't know how to tell the difference.
Right. Yeah, that is the biggest problem because if I asked another doctor, it's like, okay, what is the board, like the real board for plastic surgery? Most doctors won't know. Like they just don't know the name of the board. And there's I think now 4 or 5 boards out there that have the image that it's a plastic surgery board, like the American Board of Cosmetic Surgery and the Board of Aesthetic Surgery. None of those are boards that are considered legitimate by like a facility, right? And it's gotten kind of to be really shady where these boards will pop up and they're like, oh yeah, we'll give you a board certificate, but all it requires is maybe you go and do a weekend course instead of 3 years of surgery training. And so that's the problem. And patients don't know the difference.
Right. That is a huge problem. And there's only one board for each medical specialty. Right. If it's gastroenterology or neurosurgery or whatever. And in order to be boarded or board certified, you have to pass, oral exam, written exam, ACGME residency.
That's correct. Yeah, ACGME residency. Yeah, exactly right. Residency. And then ABMS is the board, like the American Board of Medical Specialties, which lists legitimate boards. Yeah,
Yes,
that's
ABMS.
very good. Yeah.
ABMS. And but most consumers wouldn't know the difference between the American Board of Plastic Surgery and the American, and people put these things on their websites. Right. Oh, I'm certified by the American Board of such and such.
Oh, it's so shady.
Oh, I'm sitting here right now going, I have no idea what you're talking about.
Yeah, it's so confusing.
You know what I mean? I'm the...
So as the consumer, we'll have to deep dive on that. Maybe I'll go on your show. We can talk about all that.
For sure.
No, I mean, because you got to learn to ask the right questions.
Right, yeah.
I do think both of you are really passionate about making sure patients know, like, hey, this is what you need to be looking out for to be able to ask, kind of like in one of our past episodes with me now knowing that the bag is cream that has the whatever TB.
TPN.
Well, I would just say this, because as I've gotten older, I'm good at saying the quiet part out loud. There are doctors out there who will put misleading information on their websites
100%.
in order to lure a customer, a patient, into coming to them, believing they're qualified. So that they can make money off
it's
of them.
bad, like really bad. What would you say are some of the biggest misconceptions that patients or clients have about malpractice suits in general? Like something that they believe is not really true? Is there something that everybody thinks about malpractice suits that isn't real or isn't really?
Well, I would say there's two ends of the spectrum. One end of the spectrum is people think, oh yeah, I think Texas outlawed that. Like they passed something and I'm not sure what it was, but I don't think you can bring a malpractice case anymore. That's not true.
Right.
But then there's the other complete end of the spectrum that is like we learned in law school. Some people think for every wrong there's a legal remedy. There's not.
Yeah.
And the courthouse, because of all of the legislation we've had in Texas and elsewhere, the courthouse doors are closed to about 99% of patients who were wronged in some way. They don't have a legal remedy. It's reserved for the most egregious cases and people who were permanently disabled or killed, honestly.
Yeah, and that's a great lead into my next question is, what is your thoughts on the malpractice climate in Texas compared to other states? Because I've practiced in multiple states over my career. And honestly, this is something that we as physicians think about when we're thinking about where to practice is what is the legal climate in the state? Because there are states where I wouldn't want to practice because the protections for doctors are just non-existent. But then a state like Texas, now, especially since I've gotten into expert witness, it's almost too protective for doctors. Like, what is your thoughts on that?
Well, Texas has always been a pro-business state, and I think that's good in certain senses. But most people are not even aware of the things that happen in the state legislature and how those things affect them as patients. So it's the scales are tipped heavily in favor of healthcare providers. And patients have very few rights if they are injured as a result of medical malpractice. And people get mad, they come into my office and I'm like, don't kill the messenger.
Yeah.
I didn't vote for this in 2003. But yeah, it's a very, very healthcare friendly environment. I'm from Oklahoma. Oklahoma is not known as a lefty liberal blue state, okay?
Right.
But the Oklahoma Supreme Court struck down their tort reform statute as unconstitutional. So it's hard to believe that Oklahoma is more liberal than Texas.
Yeah, and I feel like I can weigh in on this, right? Because I've seen both sides of the spectrum. I've worked in states where there's like very little protection, and I got named in 2 suits when I was a resident, which I was in one of only a few states in the United States that will allow a resident doctor to be sued. Like I think most states don't allow that. And I got caught up in these lawsuits where I just happened to see a patient one time and had zero input into their care. And suddenly I, as a resident who don't know anything, am having to, be a part of defending myself in a lawsuit, which was obviously that state is swung too far the wrong direction. Like I was like, there's no way I'm going to practice in this state. Like anyone can get roped in, and like it's a big deal to get sued. And I think that obviously there are times when it is absolutely the right thing to do, but again, when people start getting caught up that have nothing to do with it,
right.
I have a problem with that as well. And so, like for me, like Texas probably, as you said, is too protective. But then, which I don't know what state has that sweet spot where patients get everything they need, but then, doctors are not, dreading practicing as well.
Yeah.
It makes it interesting because every state's different, the laws are all different, and as somebody who goes and reads these articles about bad things that happen, it's hard to know, like, okay, is this going to be a big deal in this state or not? I mean, it's just so. Do you practice law in other states outside of Texas? Or?
Yes.
Okay.
Yes. Well, it's, as I've always said, fair and reasonable people can be fair and reasonable, and the majority of doctors that are good doctors and just want to practice good medicine, they ought to be able to practice without fear of a frivolous lawsuit. By the same token, patients who were harmed by a preventable medical error, a clear violation of the standard of care, they ought to have a legal remedy.
Yeah, agree.
To your point super quickly about getting sued as a resident, they used to call that a shotgun lawsuit, because you've got to get the buckshot, you got to hit everybody in the path. But that is a real problem, and what I would like to say is the problem is created also by the healthcare providers themselves, because we're subject to a reasonable and prudent standard ourselves. So let's say that healthcare these days is kind of a team sport.
Sure.
You don't go to the hospital and see one doctor.
Right.
This one, this one, this one, this one. We don't believe in filing frivolous lawsuits, but we're at risk if we don't sue all of the people who interacted with the patient, who wrote orders, who made diagnoses or whatever. Why? Because the defense will seize upon the one person that we didn't sue. They'll all gang up and point to what we call the empty chair. And they say, aha, well, you see, it was all the residents' fault.
Yeah.
So,
Yeah, unfortunately it becomes, almost like a shell game like that, where in order to do your job, it does kind of rope other people in. I mean, I know that when I've been involved in the expert side where, they'll ask me to look at a case and be like, okay, who should be named in the suit? I'm like, well, really, all of these people should, because something bad happened and nobody did anything. And and there's a legal logic to it too. It puts pressure, when there's that many, and especially if it's one entity to settle and not take it to court. So there's definitely some gamesmanship in it.
Yep. I think there's also kind of a herd mentality sometimes too, that they think, well, there's strength in numbers, and they'll probably blame it on the hospital, or they'll blame it on this doctor or whatever.
Yeah.
But
have you found any instances where a malpractice suit came up and the doctor did not have malpractice insurance?
That's very rare, but I'll tell you, to your point, where we see that are doctors practicing outside their scope, where they decide to open some kind of a little fly-by-night clinic or something. But the much bigger and more prevalent problem is underinsured.
Underinsured.
So the Texas, for example, has its largest malpractice insurer encourages doctors to carry the lowest limits possible. I think that at one point they were telling doctors, look, carry as little as insurance as possible, as little as is required by the hospital to get privileges or whatever, and that way you won't have a target on your back by plaintiff's lawyers. But actually it's the opposite, and I wish I could tell doctors directly, don't listen to that. Adequately insure yourself, because that's why everybody carries insurance on our automobiles, our house, so that we're adequately insured. So the majority of doctors in Texas carry $200,000 worth of coverage, which means if something catastrophic happens, guess who's liable for the excess? So
the doctor,
it's a huge problem.
Yeah, I've read some articles. I was actually kind of surprised to find that in Texas you don't have to carry malpractice insurance, to have your license. However, it's required by the facilities. So you're right, you see it in these fly-by-night places. But I've learned that in Florida, that's actually a strategy by these guys, because from just looking at cases down there, their malpractice lawyers won't go after a doctor that doesn't carry malpractice insurance, because they just file bankruptcy.
Yeah.
And so it's kind of a loophole where these guys can do basically anything, and since they don't have malpractice insurance, the lawyers won't take the case,
Yeah.
And I was just like, oh my, it's just hard to believe that that's allowed to happen, you know, because the patient's the one left holding the bag if they're injured.
Right.
And there's no recourse.
Right. You can't even operate a vehicle or drive a bus without insurance.
As an attorney that does these type of cases, like, do you have any tips for like patients that they can be proactive to avoid a situation where malpractice may occur? I know it's kind of like preparing for the unexpected, but is there something over the years you've learned that's like, oh, this is kind of a tip-off or something patients should be aware of?
Well, most patients these days are informed consumers, and most of the time people go on the internet. And if somebody has and some people may even know, oh, well, we'll go to the medical board because I read somewhere you should go check out a doctor on the medical board. And they see, oh, this doctor's certified by the American Board of such and such, pay me $400 a year, and voila, you're certified. And they're clean on the medical board, and it says here on, some site that they've got 5 stars or something, and they get fake information.
Yeah.
So patients know to do their research, but they're being fed the algorithm.
They're trying to get the information, and it's just not out there.
Yeah. So this is also a huge problem because the information is out there, but patients don't have access to it.
Yeah.
For example, patients have no access to the National Practitioner Data Bank. There's a lot of things that are reported to the medical board that don't get acted on. Hospitals, peer review committees, quality assurance, credentialing, they know things. And the poor patient is reduced to trying to sort through.
It's impossible.
It is.
Yeah, it's hard for me when I'm researching stuff as a physician, knowing everything I know, being on medical executive committees and, working on the legal side of it. It still is even hard for me to parse through all that information and find stuff out. So it's like, a patient.
And can't a doctor who's under investigation from the board still practice until he or she is charged?
For sure. Oh, yeah, absolutely.
So, that could be years, right? Some of those take years?
Oh, yeah.
No, there's like a time frame on them.
Is it? Okay.
Yeah, because you can report someone to the medical board for anything. Like, I've been reported to the boards by people that, come in and they're unhappy about, a bill, and they'll report you to the medical board. I've never had one actually come to an investigation, because what happens is, you can literally report someone for anything. They'll look at it and decide, okay, this is a case or not a case. And so, I think over 16 years, I had 3 people report me for, literally frivolous stuff. And the board looked at it and they're like, yeah, this is nothing. But if it's something big, then they'll do a whole investigation. Then the people have to send in medical records and all that. But there's a time frame to it.
Okay.
It's a few months. But yeah, I think the only thing that shows up on the medical board is you get a strike. If somebody reports something and the medical board, does their internal review and says, yes, this was, if this is outside of the standard, and they may, sanction them or make them do something, or in worst cases, lose their license. Remember we were talking about the anesthesia guy. Yeah. Is there anything that you would say is kind of deciding factors for a patient that makes them decide to file a suit? Say something happened and it's they're kind of on the fence. Is there factors poor communication with the physicians, or anything that kind of tips the scales for when people will file a suit?
I think financial hardship is what drives a lot of people. More often than not, when I meet a new client for the first time, they almost feel apologetic, I'm not the type to sue, and I feel bad. And this isn't about the money, but, my spouse, who was the breadwinner of the family, died as a result of this. We don't know what we're going to do, or it happened to me. I'm never going to be able to work again, or this resulted in a brain injury that's going to require 24/7 lifetime care. How are we going to pay for that? So I think it's usually that, and the spidey sense that something's not adding up. Most hospitals in the U.S. now have these really aggressive apology management programs.
Oh, yeah.
And they really try and do dissuade a lot of people from contacting attorneys because they're so darn nice, and most people are darn nice. And they're just like, I feel so bad. And it was just a mistake and it'll be okay. They offered to waive the bill and, you know, it's not. They're there for a reason.
Yeah.
And it's not solely to be nice.
But what advice would you give someone? Say someone's in an instance where they're getting medical treatment and they think that malpractice may have occurred. Do you have advice for them, the things that they should do in that moment, or is it something that just needs to be addressed later, or what would you advise them?
You mean when it's happening in real time?
Yeah.
I think the number one thing that people can do is document. Mm-hmm. A lot of medical errors are because of communication handoff failures, and doctors are busy. They don't necessarily have time to read the chart. I've deposed people before, doctors and nurses, and they're like, yeah, but I didn't have time to read the chart. Or somebody didn't chart something, whatever it might be, that they gave this drug or that there was a drug allergy or this, that, or the other. So really the patient almost has to be the scribe.
Right.
So keeping those notes while it's fresh on your mind is really important. Honestly, people do call us sometimes to say, this is happening in real time and I want to get my loved one transferred or I want a different doctor. There's very little we can do.
Yeah.
And it's frustrating.
Yeah, for sure. Have you, this is kind of like in more into our realm, have you seen any malpractice suits against med spas recently with the kind of the explosion of med spas in society?
Yes, and we've handled some
Have you?
ourselves.
Interesting.
Because it's, well, one of the things that was hot there for a while is they were doing hormone therapy. And they did not have skilled enough people to know who was a candidate and who was not. So they were prescribing hormones to women who shouldn't have had it because of a family history of breast cancer or whatever. And we've had some laser burns, things of that nature. But that's a hot situation right now.
Yeah, that's another thing that we talk about all the time. We literally just, the last episode we recorded, we were talking about the concern that, with all these med spas popping up, they're supposed to have a medical director. Well, a lot of times these are just empty suits. It's a doctor that doesn't know anything about what's really happening there. They may not even live in the same city. And so what you basically have is you have a facility doing medical procedures that's really run by, the mid-levels at best, or sometimes, the owner who doesn't have proper training.
Yeah.
And, we've seen some pretty crazy outcomes, where just things that are just off the pale bad have happened because people are, no one's at the wheel, right? Like the bus is driving itself.
Well, it's two things on that. Number one, again, enter stage left, the entrepreneurial physician who says, boy, it really sucks to be a frontline pulmonologist having to see patients all day. How about if I go own a bunch of medical spas or whatever? I'll just be printing checks. But the other thing is, the average consumer thinks, wow, this must be really a great advancement in medicine. Medicine has advanced so far that I can now go to the strip mall and have a medical procedure done. And after all, who wants to go to a surgery center or a hospital?
Terrible.
Why not just go, down the street?
Whenever you have a case that doesn't settle out of court, well, I guess that's a good first question. What percentage of your cases say go to trial versus settle?
I'll tell you, it depends on the lawyer, and I don't say this to brag at all, but we are so rigorous about our case selection that, and I think, after all my years practicing, one of the proudest things that I have to say is that defense lawyers, that represent doctors and hospitals, they're like, if Kay and Luke are filing a case, we know it's probably a good case because they're not here to play around. Right. So it's not because we don't want to go to trial. It's not because we don't try cases, but the vast majority do settle.
Yeah.
After we work it up and are ready for trial.
Yeah. So that's with the group that I work with here in Dallas. Like we kind of do the same thing. Like we're pretty selective about the cases, and we expect. I think we have We did have 5. One just settled, and we have 4 more going. Our expectation is none of them will go to trial. Like they're slam dunks. You know, like they'll settle out of court. And but if you do go, so say your law firm does take it to trial, like what kind of expense is that for you guys on on your side of it to have a trial that may last a week? Is that a huge expense? And this is going to come along for me asking like, when someone gets a malpractice suit, like what do they get out of it?
Yeah, that's why so many medical malpractice cases are not economically viable. A simple case to get to trial, $150,000.
Yeah.
A more complex case with multiple parties, $250,000. A complex birth injury case with even more experts, maybe $350,000. And that's money that the lawyer is putting into the case. So the way I try to explain it is like this. The people that we sue are generally covered by insurance or they're large hospital corporations. They have a team of lawyers that are getting paid by the hour. And so if you're working on a case 3 to 5 years, their legal bills are hundreds of thousands of dollars. We're working, hoping to get paid if we win. We're working the same number of hours, plus we're putting money into the case, into it. So people get mad at us when we say, I'm sorry, we can't take your case. And they're like, well, you suck. You must be a terrible human being. Well, they always go there. You must be a horrible lawyer and a horrible human being. And I'm like, well, actually, we're trying to help people here, but that's the biggest problem is if you can't take a case that's capped at $250,000 in damages and spend 150 or 2 or 200.
Right.
It's nobody.
Yeah, it's not economically viable. Yeah, that's one of the things that we figured out too. So, kind of the last question here, and then I want to go over some cases. Like, what piece of advice would you give to physicians if they want to avoid, having a malpractice suit against them? Is there anything that you can tell them, knowing what you know, having done this for so long, that they can do to stay out of your way?
I would say, if you're going to vary from a standard protocol, document your medical decision making. It's, medicine is an art, not always a science. Like you say, standard of care isn't always written, but document your medical decision making. And I'm not saying that all entrepreneurial doctors are bad. They're certainly not. There's a service there, but stay in your wheelhouse.
Yeah.
Do what you went to school to train for.
Right.
And what I'd like to say also is, don't think that you have to continue to operate in a system. If you're affiliated with a hospital system or an employer who is making you practice bad medicine because of what they're imposing on you, go do something else.
It's not worth it.
Yeah.
Yeah, unfortunately, that becomes more and more of a thing. So many physicians these days are employees.
Yeah.
I'm one of the last of the dinosaurs. Like, I've been in solo practice by myself for 16 years, and it's just hard. I mean, the system is designed for people to have strength in numbers. And so, that's kind of a sad thing. All right, so I was going to just talk about a couple cases if you have time.
Okay,
These are kind of like really crazy stuff that we've talked about. And you may or may not have anything to weigh in on, but some of these are kind of wild. They're all sad too, unfortunately. So first one we talked about a couple weeks ago, there was a woman that was living in North Carolina. She lost some weight. She'd been taking Ozempic. She wanted to get some plastic surgeries done, but she wanted to get 6 surgeries at once. And none of these were minor surgeries. And so she went to a bunch of physicians, a bunch of surgeons around her hometown. Everybody was like, absolutely not. There's no way we're going to do this many surgeries on you at one time. So then she gets on social media, finds a doctor here in Texas, in Houston, who said, yes, I will do those 6 surgeries at once. Patient flies down here. So in one day, she had a tummy tuck, arm lift, breast implants, lipo 360, circumferential body lift, and a Brazilian butt lift. Okay? She makes it out of surgery. She goes to recovery. and immediately starts to kind of go down the tubes. She was basically having trouble saturating. They took a hemoglobin, which was recorded to be 4, normal is 12 to 15. Patient started decompensating. They finally called EMS. She went to a hospital. 2 hours later, she went into cardiac arrest, died. They did get an autopsy, and the autopsy reported that she basically died from massive hemorrhagic shock. She basically started bleeding, then her coagulation factors got out of sorts, which made her bleed more, and it's just kind of like a circular going down the drain. I was shocked by this one. What do you think about this case?
That's, as I'm sure you would agree, huge red flags.
Yeah.
The complication rate, each one of those surgeries, you add on top of that, your risk for complications multiplies. Yeah. So a reasonable and prudent plastic surgeon would say...
This was a plastic surgeon, by the way, which
really?
I was shocked.
Wow.
Shocked to find that out.
Yes.
A board-certified plastic surgeon.
Wow, that is shocking.
Yeah.
But a reasonable and prudent board-certified plastic surgeon would have refused, like the other 6 did. And the Brazilian butt lift itself added on a much higher
I will
complication
not do those.
rate.
I talk about those all the time. I do
He
not
does not
like
like
these
those.
surgeries. I hate them. I won't perform one. I mean, I'm giving up easy money because we have people call and ask for them. But and just for what it's worth, I limit people to 2 major procedures. That's it. If they want to have 3, they want to have 4, I'm not their guy. I'll just be like, 2's it. You can pick your favorite 2, and we'll do those. And 3 months later, we'll do 2 more. But 6 at once. I wonder if this case will end up with criminal charges.
Yeah.
I mean, that's the new thing these days. That used to never happen. And then Dunst, Christopher Dunst, that was kind of the first one. And now we see it. We just did a segment, 2 or 3 segments in the last month about doctors that are facing jail time.
It's because sometimes it really does pass beyond. This was just a momentary lapse of good decision making into this was criminally
negligent homicide.
Negligent. I was going to say, you asked the question, what makes it negligent?
Yeah.
This.
Yeah. I agree. When the first time that happened, I was like, whoa, I can't believe somebody went to jail for malpractice. But sometimes that's the right thing. Okay, this one, you must have heard of this one. Maybe, maybe not. There's a man in Florida, goes to the ER. He's got abdominal pain. They get a CT scan. His spleen's a little bit enlarged. General surgeon comes in, says, we need to take out your spleen.
Oh, yeah.
You've heard this, haven't you?
I've heard this one, yes.
So goes to surgery. The surgeon reports, oddly enough, the operative report was on the internet. I read the actual op report. They started laparoscopically. He gets into bleeding, opens him up, takes out the spleen, sends it off to pathology. The patient goes into cardiac arrest and dies. And it's like, oh, well, that's unfortunate, until the pathology report came back and it was the liver that he took out and not the spleen.
Yeah. Well,
I have theories, but I want to hear what you think, because I have some theories on this one.
Well, I was going to just punt it back to you and say, how old were you in your medical education journey
when you got when I knew the difference between the spleen and the liver?
Yes.
That would be like 3rd or 4th year of med school.
Yeah.
So my feeling is that this was a cover-up. The guy did not think he was pulling out the spleen. It's impossible. It's impossible to believe that he took out the liver thinking it was a spleen. It's inconceivable. They're so different in size, position, attachments, impossible. I think what happened probably was, he starts laparoscopically. He mistaked the left lobe of the liver for the spleen. That is possible when you're using a scope. Scope stuff is completely different than open. He started dissecting out the left lobe of the liver, got into the portavessels, things started bleeding, opens it up, realized what he did, tries to stop the bleeding, and just, makes up this story that it was a splenic artery aneurysm, pulls out the liver, probably told him not to send it to pathology, because obviously that would crater his story. But they sent it anyway, and then it came back as a liver, and then the whole thing blew up. That's my theory, but that one's criminal too. That guy got arrested. So we'll figure out what happened eventually.
That's going to be fascinating to watch. Or I would say, or is it possible that he was impaired and,
Somebody, was it you that asked me that?
Yeah.
So here, this is going to sound terrible. I don't care how many beers I've drank in. There's no way I'm mistaking the liver for. It's like mistaking a cow for a horse. I mean, I guess maybe,
Right.
but I think you wouldn't be able to stand if you were that impaired.
Well, Christopher Dunch would operate, and there was one of my clients, actually, he was implanting the spinal hardware, which is to go into the bony vertebra, and he did the whole operation outside the spine, in the muscle outside the spine. So I guess it is possible to be that disoriented, but I agree with you. It's hard to conceive.
It's hard to conceive it.
Yes.
Yeah.
Yeah.
All right, let's do one more. I know you probably gotta wrap this up.
I could talk about this stuff all day long.
They're so interesting, like trying to figure out what happened.
And then I could tell you some of war stories of my own. There was a case, it's probably been 30 years ago, and it had to do with an endoscopic sinus surgery.
Okay.
Is this the ethmoid? It's been a moment. The ethmoid
frontal
sinuses. Whichever ones, the ones that are here.
Okay, the ethmoid would be right there in the center.
He's going up, biting, whatever. And he sends off what he's removing, the sinus stuff.
I know where this is going.
Yeah, you know where it's going.
Yeah, go ahead.
And it's bits of the brain.
Yeah.
He's just
What?
operating away. And
How?
And
Well, the sinuses are pretty thin-walled. Like, you could conceivably go through it and then end up intracranial.
I'm sorry.
I mean, you shouldn't.
Can we go
like,
back?
Yeah.
I'm not saying that should happen, but when she started talking, I was like, this is going to be brain samples.
yes.
Yeah.
So I remember I was deposing that ENT doctor. This has been years and years ago. And I said, what did you think you were removing? And he said, and I quote, I just thought it was a big booger.
Oh my
I was
goodness.
like, well, that big booger was
Did the
my
patient
client's
die?
brain. No.
Yeah. You can
He
go
did
without
not.
your frontal lobe, quite a bit of it, and still carry on.
Right?
I'm unwell.
Yeah, no, he had to have
We don't want to,
craniotomy and
Yeah,
you know, all
yeah. It
that,
obviously
but-
was not a good thing.
right. Yeah, he lived.
Wow. That's
You
crazy.
thought it was a booger? Like, is the brain look like that? Now I need to know if the brain looks like that.
I mean, you
that's
wonder
my
how he got through like the dura mater and stuff, right? Like,
Yeah.
I mean, the brain's not just sitting there, right?
Well, that's
It's
my
like
question.
layering. It's like, yeah. who knows?
Right.
All right, this is the last one. All right, so this woman in Virginia, she's got breast implants. She wants to get them removed. She goes to a breast center, which is kind of weird. You'd want to go to a plastic surgeon, not like a breast center where they historically treat breast pathology. They do some just cursory exams. They come in, they tell her, you need to have a mastectomy right away. There's something on your scan. We're really worried that if you don't get a mastectomy, you're going to have cancer. So she gets talked into having mastectomies. The surgeon comes in. She meets the surgeon, I guess, like the day before surgery. The surgeon does the mastectomies and then does the reconstruction themselves in the same case. So you have a general surgeon doing reconstructive surgery. That goes badly. Patient requires multiple operations because of the failure of the reconstruction. The surgeon leaves town to take another job. The new surgeon comes in, sees the patient, said, I looked at your file and there was nothing on your scans to indicate that you need a mastectomy. So you basically have somebody practicing outside of scope. And then also there was, I guess, misinformation given to the patient that made them get mastectomies that they didn't need.
So it was all for money, though, right? Basically.
Yeah, probably,
okay.
Yeah. There's a $25 million suit in that one
Wow.
that's pending.
That's wild. I thought you were going to say that the scans got mixed up and the surgeon was looking at somebody who did need a mastectomy. You know, that happens sometimes, but this was just blatant.
Just blatant fraud, I guess is the right word.
Yeah. Yeah.
I mean, there's so much bad in that with the practicing outside of scope and, you know, pressuring someone to get a mastectomy without a biopsy.
Yeah.
I mean, sometimes I read these things and I'm just like, what's going on out there?
Yeah. What's that old thing? If all you have is a hammer, everything looks like a nail.
Every the world's a nail.
Yeah.
Yep.
So it's like next.
Well, tell us about your podcast. I meant to ask this at the very beginning. We kind of got talking right about the malpractice stuff. You've been doing a podcast for a little while now, correct?
I have. It's my passion project.
Yeah.
I'm still practicing law, representing patients. But about 12 years ago, after I worked on the Dr. Dunch cases, I formed a little group. We called it No More Dr. Deaths. And it was some of the doctors that were involved in the Dr. Death case, the prosecutor, a former hospital administrator that wanted to come over to the good side, left the dark side, came to the good side.
Yeah.
But I don't know. It was kind of my I'm mad as hell and I can't take it anymore moment. And as I was getting older, I was like, there's only so many people I can help. I want to do what I can to improve our healthcare system. I want to educate patients. I want to advocate for reform of the system. And I think a lot of doctors and hospital administrators, nurses, I think there's a lot of agreement between us. Lawyers and doctors used to kind of be like oil and water, but I think there's a lot of people who are like, yeah, our system's broken, it needs to be fixed.
Did you, and I apologize if I didn't know, were you involved in the Dunch case?
Yes.
How were you involved with that?
I represented the majority of his victims in the civil cases.
Oh, I had no idea.
So,
wow, that's huge.
Yeah, there were other, credit where credit is due, there were other lawyers who also represented patients, but I had roughly 10 to 12 clients. And so I was heavily involved in all of that. And that was kind of what put me over the edge, I guess.
Oh, I can imagine. And we talk about that as physicians, about that case. There was a lot of things that happened that shouldn't, but you probably heard this in the trial. The concern is that it's pretty easy for doctors to sue facilities, like if they don't get privileges. And as being on a I've been on medical executive committee. So medical executive committee is involved with like the safety protocols and the credentialing. And there's been times when we've had people that wanted to get credentials at our facility, and they have maybe a little bit of a checkered past, and someone will always be like, well, is this going to result in a lawsuit if we don't give them credentialing?
Yeah.
And so I think that probably in that case is what ended up happening. But again, you probably know more, having gone through the whole case, that they were just worried about getting sued by him, even though they really shouldn't have given privileges.
I think a couple of things. I think there's that, but there's immunity for hospitals that make those decisions in good faith. And so it's very hard for a doctor to sue a facility for stripping their privileges or whatnot, but those damages are not capped. So what I always said is, Dr. Dunch was a young neurosurgeon. If his earning capacity was $1 to $2 million a year over the course of a 20-year lifespan, and he could say, they ruined me. They reported me to the data bank, nobody else would take me, whatever. They were facing a lot more damages than somebody who has caps because of tort reform. But also, by the same token, a young neurosurgeon just starting his career with impeccable credentials on paper could come to a hospital and make millions for the hospital. So it's kind of like there's problems, but look over here what they're capable of. And so, especially to a failing hospital, some of the hospitals.
That probably weighed in on it.
Yeah.
Where can people find you? Like website, social media, your podcasts? Where we can put all the information up here, but where's the best place to find you if people want to find you on the social webs?
I haven't Googled myself in a long time, but it's K Vanway, VANWEY, and that will probably lead them to the website.
Okay.
The firm's name is Vanway and Metzler. The podcast is Advocate, like with my name, Advocate.
Very clever.
Kind of,
Very clever.
And that is on Apple Podcasts, Spotify, YouTube.
Yeah.
All the places. This did not happen when we still had Selectric typewriters and the books, but
it's
now
a brave new world out there.
It seems to be the thing.
Yeah,
but
absolutely.
for her first season was all about Dr. Death case. Like it was just focused on that and focused on the players and the people that were involved in it. And then season 2's coming out and very soon. So.
Very soon, yeah. We spent the whole first season on Dr. Death, and so we're all still together. The band is still together.
Yeah. Were you involved with the podcast, the Dr. Death podcast, like the original one?
Yes.
Oh, were you?
Yes.
Oh, excellent.
And I had Laura Beal as my last guest on season 1.
Wow.
So.
Excellent.
Yeah.
I didn't realize that you were involved in all that. That's great. Yeah, it's something we always hear about in the medical the medical community about Dunch. I remember we listened to that podcast on the OR during cases.
Oh my God.
Like while you were operating?
Yeah, we always have music and stuff going.
Don't do
so sometimes people will put something else on.
Yeah.
That's a common thing in the OR. There's always something playing. Otherwise, it's just quiet.
Yeah.
Yeah.
Well, I get that, but it's like, hey, well, don't do what he did,
Oh, right. Yeah, absolutely. Yeah.
Right. Or here's something alarming, and flinch or
Yeah,
something.
What did he say? What did he do?
No, it didn't happen.
I'd be interested, what would a surgeon in the OR listening to the Dr. Death podcast think? Would you think, that's really alarming, I've never heard of something like that? Or would you think, yeah, I could kind of see that happening?
I mean, you definitely can see it happening. I mean, we've all known people who are not good at their jobs. I'm sure you know lawyers who are not good at their jobs. I mean, I know, over the years I've known doctors not good at theirs. So yeah, it's definitely believable. And then you add in things like impairment. Yeah, it's totally, it's not hard to believe at all, actually.
Yeah.
So sadly.
Right.
So. Well, listen, thank you so much for coming on the show. It's been great to talk to you, and hopefully sometime we'll come over on your podcast so we can talk about some more stuff.
Definitely. I'd love to continue the conversation. So thanks for having me.
Absolutely. All right. Thank you guys so much for tuning in. We really do appreciate it. Please find her on the podcast, Advocate. Go to her webpage, check her out. Leave us a comment. If you have anything you want us to talk about on the next episode of Nip Talk, we'd love to talk about it. We'll see you next time. Bye.